So we'll quickly get to look at the differences between acute and chronic. So acute and chronic is some medical terminology that are mostly used when we are talking about pain, when we're talking about the illness, or when we're talking about the disease condition of a patient. Okay, acute and chronic. So it's just simple. Acute and chronic simply have to do with what the duration. Okay, and even the symptoms. There's a way the symptoms of acute will show up. There's a way the symptoms of chronic will show up. So let's talk about it. In medicine, the term acute and chronic are used to describe the duration and progression of disease or conditions. Okay, so for acute, the duration is short term and typically just for few days to few weeks. Okay, onset is since it is within a short time, it has a rapid onset. Okay, with the symptoms appearing just all of a sudden. Bah. Okay, symptoms are often severe and noticeable, prompting immediate medical attention. We have a tabular comparison too, which we'll look at, okay, before ending the lecture. Example is acute bronchitis, acute myocardial infarction, acute appendicitis, acute hepatitis. What is the outcome? Acute conditions resolve completely with appropriate treatment, okay? Or if they stay there for a long time now, they become chronic, okay? So what is a chronic now? This one, the duration is long and persists for more than 6 months or longer, okay, or often for life. Onset, they have a slow and gradual onset. Probably the patient did not even notice it was what? Without symptoms, asymptomatic, okay? But with time, they develop symptoms, okay? So the symptoms can be milder or less noticeable in the early stages, making them harder to dictate without regular medical checkups, okay? So examples is what? Chronic obstructive pulmonary disease, chronic kidney disease, chronic hepatitis, diabetes, hypertension, all of that. So what is the outcome? Chronic conditions usually require ongoing management and treatment just to control symptoms and prevent complications. They often have periods of remissions where symptoms improve and later on the symptoms will now what? Get worse again. Get. So on the scale, I'm trying to compare them on the table. For the onset, acute is rapid, chronic is gradual for the course. Acute there is usually one cause, chronic there are usually many complications. You get. Duration, acute lasts for just few days to few weeks. Chronic is from 6 weeks, all right, or more than a few weeks. Okay. Diagnosis is commonly accurate for acute. For chronic condition, you have to do a lot of things before you now know what's the problem. So the test is often decisive. Test is often of limited value because so many complications now. Okay. So I think that's it for the important things that you need to know about differences between acute and chronic when you're talking about pain, illness, and disease.